What's the strangest food you've pulled out of someone? Practicing medicine in a parking lot, getting stuck accidentally by a needle, and the one symptom that makes a doctor drop everything. Today, I'm answering your most unhinged questions about what's really going down behind those swinging ER doors. Let's dive right in. What's the strangest food you've pulled out of someone? So I would say there's two food items that are weird, and it was because of like their location. One of them was chicken wings in the wrong area. I'll leave it at that. And then the other one would be a mango. It's just really big. It takes some time to have to pull it out of somebody. Any food item could actually go inside the body that a doctor has to pull out that shouldn't be there in the wrong area, because you can eat the appropriate foods, but when it starts going into other places that we have to pull it out, please don't do that. What happens if someone dies in the waiting room? It could happen, especially if it's a very busy emergency department. But if you're not watching every single patient in the waiting room, which you can't, these things can happen. So if somebody is found to immediately have passed away, obviously staff is going to go get the person on a gurney right away, get them back to a room and run a cardiac arrest code on them. I think this question is alluding to if somebody is just found after hours that have passed away. That is sad. I hope that doesn't happen. It hasn't happened in any of the hospitals that I've worked at. Have you ever been stuck by a needle or had a patient with HIV, for instance, and had to be treated yourself after treating a patient? Great question. Yes, I have stuck myself with a needle, but for myself, the needles that I stuck myself with were suture needles, so they're not bored, so there's not a hole. They're solid. The likelihood of transmission is pretty low. Early on in my career, that happened just from manipulating the very small needle. They were like this big and a little finger prick. But the patients that I had were not high-risk patients, and it was a situation that wasn't high risk, so no, I didn't end up having to treat myself. What's an ER myth that drives you nuts, but TV keeps spreading? There's actually a few that pop into mind, like on these shows where the specialists are working in the emergency department. Usually they're working with an ER doctor as a resident, and they're not as engaged, so to speak, as say like the emergency medicine residents would be. And the other thing, a lot of when it comes to like procedural things that you see at the hospital versus like on TV, you see like the tubes that they use on TV, they're totally like in the wrong places and not the right depths, and they just look weird. And it always gets me that like CPR is never done right on TV. What's the one symptom that makes every ER doctor drop everything? One symptom that does come to mind is pretty much like any stroke, because it's time sensitive. The staff is alerted that somebody is having stroke-like symptoms. ER doctor needs to drop everything and get over there. The other thing an ER doctor would drop everything for to go take care of is if somebody comes in cardiac arrest. All of that stuff is time sensitive, and we need to excuse ourselves nicely and go out of the room and take care of that immediately. What's the strangest ER you've worked in? A tent, a gym, a parking lot during a disaster response? Probably the strangest was COVID times when we were outside in parking lots. Sometimes there were tents like the TV show MASH. Seeing patients in their own cars and giving them oxygen tanks was definitely something that I wasn't trained for in residency or medical school, but you adapted and you did what you could to help patients, help the most amount of patients with the resources that we had. What's the busiest day of the week at the ER so I can avoid those days? Monday. Monday is the busiest day in the emergency department across the board. Sometimes if Monday is a holiday and then Tuesday is the beginning of the work week, it'll be a Tuesday. Usually people are off for 2 days, the weekend. For whatever reason, either they couldn't get into the doctor for the weekend, they didn't want to come to the emergency department during the weekend, and then they show up on Monday. Monday is just a very, very busy day. Is it true that some religions won't do blood transfusions or other life-saving procedures in the ED? Yes. So an example of this would be Jehovah's Witnesses. They do not want blood transfusions. So we do have other protocols to help with trying to get their blood counts up, but they don't work as well. So we do have that serious conversation with individuals, and sometimes their religious stance and view takes precedence, and people can pass away, say they're in need of so much blood that the other protocols won't be sufficient enough for them. What's an emergency room pickle that you have been in? Like 2 emergencies happening at once, specialists refusing to come in. Typically, it's usually related to like getting other people help, in the sense of you can have multiple emergencies happening at one time. It gets in a little bit of a pickle, but you can manage them. Like say somebody comes in, a cardiac arrest, a stroke, a respiratory problem. An ER doctor can manage all 3 of that at the same time. We're very good at managing multiple chaotic things at once. That's our specialty. That's what we're good at. Can you refuse to give someone prescription drugs in the emergency department? Yes. It's not really like a refuse, but it's our medical judgment to prescribe people medications, right? So if somebody demands an antibiotic, but they don't have an infection that requires an antibiotic, I'm not going to prescribe one, right? That's an example. The big thing that people always bring up is having to do with pain medication and opiates. And so if a doctor deems that, they're concerned about you, they're concerned about addiction, doctors have access to seeing your previous prescriptions. And so if they don't feel it warranted, they may give you medication in the emergency department, but they may be hesitant to give a prescription. What if I lie about how I got injured? Does it change care? Not necessarily, but there's really no point in lying to the doctor, just because sometimes a mechanism of injury actually does change care, but in general, the majority of the time it probably does not. But an example would be people who have a boxer's fracture on their hand. You get it from punching something. People will say they fell. They just lie to us, and we're like, well, obviously we know that that's not the case, but it doesn't really matter. The care is still the same. Do you think hospitals should be allowed to turn away patients? Having worked in one in Illinois, I've seen people in the ER for stupid things like a cold or a lot of homeless that would abuse the 911 system. That used to be a thing a long time ago where hospitals could pick and choose the patients that they wanted to see, but it becomes an issue relating to financial things, like if somebody has insurance or not, and then you're not going to treat them because they don't have insurance. So you're not allowed to do that. There's something called an EMTALA violation, and so you have to do a medical screening exam on every single person that is seeking medical care. Have you ever treated your own family member in the hospital? Great question, and no. I don't think I would want to either. I think my judgment might be a little skewed, even though I would want to believe that it wouldn't be. But being a part of the care or being kind of kept up to date is quite helpful. But having somebody that does not have an emotional ties to it is probably pretty important. And so same thing kind of goes for friends as well. Being an advocate for a friend or a family member is great, but being their primary caregiver, probably not the smartest thing. What if I come in unconscious? Who consents for treatment? It is our job to assume if you're unconscious and you have a medical emergency, that anybody in your situation that is conscious would typically say, yes, you need to treat that. That type of consent is something called implied consent. So it's implied that any normal person in your scenario would want medical care. But, it becomes a little bit gray. If they're underage, you can do medical stabilization, but anything further, you typically hold off until you try to get in touch with the parent. But when somebody is in a medical emergency, it's implied that that person probably would want help. You always say, don't pull it out. Have you ever had a patient come in with something they actually didn't pull out and had to get pulled out in the ED, like an arrow, shrapnel? Yes, actually very often. Usually it has to do with big objects where large caliber fences, long pieces of wood, a lot of these bigger structures, a lot of people just leave in because either they're stuck or they're too scared to pull it out. When it comes to smaller things or very rarely do you ever see a knife that's still stuck in somebody. Usually it's due to an assault and somebody actually pulled it out because they're still holding it, that sort of thing. They're not just leaving it in. A lot of death can potentially happen in a hospital. Have you ever worked in a haunted ER? Very good question. I've never noticed any haunting experiences while I've worked in the ER, but yes, that makes a lot of sense, right? People pass away, especially in the emergency department or in the hospitals, and you assume that there could be afterlife stuff going on, paranormal activity, but that would be very interesting. All right, well, these are great. Keep them coming. These are fantastic. This is just me sharing my thoughts with you guys about the day in the life of what we do in the emergency department. So this is great. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.